help you?
Busy, busy, busy.
I have been experiencing some nipple tenderness.
I've started like cutting and stuff like that again.
And do you find the cutting's a bit of a release for you?
It does, but I mean, I used to work at the ambulance service, so I know it doesn't help. You all right?
Yeah.
Oh, do you want paper towel as well?
My legs feel a little bit dead. It just feels weird when I walk.
Okay.
Thank you. I think you've had the 10 minutes now, more actually.
Don't worry. The 10 minutes is only a guide. It's more important about making sure that we manage you as a patient effectively.
If you feel pushing, that's fine, right? If it's sharp, then tell me. Can you feel any of that?
Hello, darling. Let me have a look at your hands.
Not good, no skin.
They're a lot better than they were, though.
No, the rest of my body, I've got no skin left.
I know it's you taking your skin off and regenerating it, but it looks a lot better.
I need some more.
You have to some more.
Let me have a look. But not enough for my whole body.
Give me your date of birth, sweetie.
23rd of the 10th, 55, spring chicken.
Juliet, yeah?
Can you have a seat down there? How you doing?
Well, I cut my hand the other day. I'm really sorry if this is like a waste of time and everything, but
Okay.
I'm worried. Right, I was doing a washing up, had my hand in a pipe class, went across, cut it, went to A&E. As I've been working and everything, because I've had to still go to work, I think all the cuts open.
Yeah.
I don't know why I'm wrong, but when I'm holding it, I can't really lift my fingers up, and I don't know if I've damaged something. It just got me
Okay, worried about it.
really worried, because I need my hand to do my job.
You right-handed or left-handed?
Right-handed.
Okay. When was the actual injury?
Wednesday night.
Wednesday night last week?
Yes.
Okay, and so you went to A&E straight away after that?
We went to the walking centre, but yeah, A&E.
And you were saying that you were washing...
I was washing, I had my hands inside a pint glass and it broke and I twisted it. Yeah.
Okay, fine.
If I try and force it up, it's really like I shouldn't be forcing it.
Just show me what you mean.
So if I just do it,
Is that your wrist as well as the fingers?
No, I can hold it, but
you can't get the fingers up. Okay, let's have a look. Let's put your hand down.
because I've got to keep working everything.
I
fit shutters and doors and drive stuff.
Can you feel me touching your fingers along there?
Yeah.
Same as the other side?
It feels a bit faint that side, but yeah, I can feel that.
Just squeeze my fingers for me. What's stopping you in here? Pain? You feel the stretch, or is it that you physically can't do it? Okay, you can relax again.
Ouch.
Push up against my finger?
No, I can't even, no. That one.
Avneet, cool. Hi, come in. Right, so what we're going to do today is we're going to start the vaccinations, OK? So today there's 3 injections and 1 medicine in the mouth. OK. So the one in the mouth is to protect the lining of the gut. OK, so because a lot of babies get diarrhoea and vomiting, they end up in hospital really dehydrated. A side effect, which I've never seen, but I'll just tell you about, is a problem with the guts, strangely enough, OK? The other 3 injections we're going to give in her legs. One of them is the meningitis B, and the research shows that it's quite likely she might develop a temperature with that one. Buy yourself some paracetamol, the brand name's Calpol, and that should be enough just to settle her temperature. So I'm going to draw up the vaccines, yeah? Oh, bless her. Are you feeding her yourself? Oh, wonderful. So that's what she's waiting for, isn't it? Oh.
So if I hold her, she's going to cry.
Of course she will. Of course she will.
You're scared of
I'm
them.
more scared of it than she.
Oh, bless you. I know, it's not milk, is it?
Okay. I heard you.
Right, hold still. All done. You all right? Yeah. Oh, do you want paper towel as well? There we go. Oh, you're still going? Oh, bless you.
She's all right.
OK, so make an appointment on the way out for 4 weeks' time, baby clinic. That's all right. You can stop crying now. We're finished. That's all right. See you again. Bye-bye.
Thank you.
All right, thank you.
Just need to put my baby's 4th week injection.
You just came in with that cute little baby. I hope you feel really horrible making her have an injection. Did she cry?
Loads. Yeah, even the mother cried.
Do you know what? I never used to take mine. I used to make my husband take them.
Yeah.
And do you know what? He found the best way to get the heat out of it? Get one of the small cans, put it in the fridge, and when it's had it done, just rub it on it. Just takes the heat out.
Okay. Thank you.
That is not looking that great, is it? It's looking a bit infected.
Does it?
But at least it's dry.
Okay.
And this one. Sorry.
It's all right, I just don't want to look at it in a second.
It was quite deep, isn't it? So I want you to leave that there. I'm going to get one of the nurses to come up so they can sort out a dressing for us.
Okay.
And then I'll talk to you about what I think we should do about the actual thing itself. I'll be back in a second, right?
Thank you very much. Stupid problems to have.
He always gets up air, very itchy on my legs as well.
Basically, his ear keeps splitting open.
Okay.
I was given some steroid cream, and it seems to not be working anymore.
Oh.
It's so greasy.
One of the most common causes of itchy skin is dry skin. So the more you moisturise, the less itchy your skin will probably be.
Yeah, just slap it on, I don't care.
You're not getting any weeping or anything like that in your
Do you know what?
legs?
It's not even the cream you're putting on. You know what it is? It's the touch.
Use it once a day sparingly, the gel.
I don't think this is any rash to be worried about, OK? What I would advise is just make sure baby skin generally is well moisturised, OK?
No, hold that. It's your medicine.
It's like a mayonnaise bottle.
Yeah, don't want to put that on your chips.
Mr. Arif.
Thank you very much.
You're very welcome. Just take a seat. How can I help?
Now, these blisters come on. Here, here, here. And somebody told me that you can get a plaster from the surgery or something.
No, you would just use cream for those. You wouldn't use a plaster for those, yeah.
I punctured the bloody thing.
Oh, yeah, yes. I don't think that's such a good idea.
Isn't it?
No, you could introduce infection.
Oh, I see.
And then it could flare up. What do you puncture them with?
A sewing needle.
Sewing needle, yeah. No, because sewing needle would not be sterile.
Oh, no.
So it might be clean, but it wouldn't be sterile.
I usually put it under the hot water tap.
Well, that's good, or boiling water, but still not a good idea.
Right,
no, this is a form of inflammation of the skin called Ponphylix. It's a type of eczema. Used you have eczema in the past? Is that something you've had for many years?
I had eczema in 2011, actually.
Was that the first time?
First time in my life.
You can get eczema at any stage. What brought it on, do you think, in 2011?
I have no idea, actually.
It just came. What I'm going to do is I'm going to give you a powerful steroid ointment. Now, ointment is rather sticky and gooey, so I apologise for that. But the reason I'm giving it is that the absorption of an ointment is much better.
All right.
So I want you to use those on all of the blistering areas.
Right. Thank you very much.
Good. You're welcome. Nice to see you.
Bye-bye, sir.
Bye now.
What's going around in my mind is whether this is to do with pain that's stopping you doing this, or whether it's deep enough that you might have cut something that needs more attention, right? And I'm not sure is the honest answer.
Okay.
So I'm going to have a chat with the on-call plastic surgeons about this, just to see whether they're willing to have a look at it today and see what they make of the function, right? Is that going to be okay for work-wise and stuff? You're looking a bit worried.
Sorry.
I think it's. I think
pain and it's pretty deep. You don't think it's a tendon.
Well, that's the reason why I'm going to ask them. And they're going to say one or two things to me. They're going to say, well, you know, maybe it's just inflammation, see how it goes, but then we get you to come back, and in which case I'll come down and I'll let you know either way, right?
Okay, brilliant.
Or they're going to say, well, if you're not sure, we'll have a look. Okay. And then they'll assess it. Okay, we've got a nurse downstairs who's just going to clean this up for us. So, do you want to come with me?
Yeah, brilliant. I've got a second, just got to get that out, so I look cool.
That's all right.
Hello, sweet soul. Where have you been?
I've been fishing around.
Have you?
Yes.
I do miss you when you don't come in, but I know that you're well, so that's okay.
Thank you.
Oh, hi there. My name's Mustafa. I'm one of the GPs from Farnham Road Surgery. Can I talk to you about a patient, please? A glass broke while he was doing the washing up, so he's got a laceration to his dominant hand, his right hand. I can't tell how deep it is, but it's quite granulated over the top. So I don't know whether he's done any sort of tendon damage underneath that or whether this is just because of the inflammation from the cuts. I was wondering whether you'd be able to have a look. How quick should that referral be? How urgent should I put it? OK, fine. That's perfect. Thank you. Cheers. Bye. Bye. So basically, I sort out the referral, which I'll do today, and we'll fax it off to them. In the next 2 weeks, if you haven't heard from Plastics then about a clinic appointment with them, then I want you to let us know.
Okay, like you say, it's just all cut up, isn't it?
So then the thing with this is that if they review it and they say to you, you know what, we're really not worried about this, then the next thing will be to make sure that that stiffness doesn't remain as bad as it is now. So they might send you some physiotherapy. So there might still be an impact on your work for a little while to come. Maybe not as bad as having to take the whole time.
At least I'll be able to drive and do something.
So we'll have to figure that out as we go along, depending on what they make of it. But that's your sick note, and it's from today for 2 weeks. Okay. I'd shake your hand, but I don't think I want to cause you any more pain. All right, take care.
No, seriously, thank you very much.
Take care. See ya. Bye.
It's Dr. Hyder. Come through and have a seat.
Thanks.
Are you Mum?
Yes, I am.
How can I help you today, Cohen? I know you've had some back pain, haven't you?
Yeah.
When did it all start?
The school phoned me to say that he had this severe pain in his back.
Okay.
And if I could drop some paracetamol down, but it just got too bad for him. He was crying in pain, and then he still got it. It's just kind of come out of nowhere.
Yeah.
It's just that he's cried with it, and that's not like him.
Yeah, yeah. So how did it start when you were at school? What were you doing at the time?
I now got on a coach. And that's when it started, but I don't know how.
Was that the school bus? Yeah. Okay. So in the morning. Yeah. And then was the pain bad at that point, or did it get worse later?
It got worse later on, and it just stayed like that.
Okay. And whereabouts in your back does it hurt?
It's around here.
The middle bit of your back.
Yeah, and then lower down up to like there.
All right. Any problems going to the toilet to wee or poo?
No.
Is that normal? Yep. Okay. And any numbness or weakness or tingling, like a strange sensation in your legs at all?
My legs feel a little bit dead.
Which one?
Both of them, but they're just down here.
Okay. All right.
It's a little bit hard to walk, but
is it because you've got pain walking, or it feels numb when you're walking?
I don't really know. It just feels weird when I walk.
Now, would it be all right to examine your back? Yeah. Okay, your mum can sit on there and then you'll be with him as well.
You sure? Yeah. Okay.
Back pain can be a symptom of something quite serious in children. Most commonly, it's because of a muscular problem or a bone or joint problem in the spine, but more worryingly, it could be related to infection or even something as serious as a tumour. So I'm going to just test a few things with your arms and legs. Are you okay sitting for now? Yeah. Can you put your arms up like this? Stop me from pushing you down. Okay, stop me from pushing them up. Put your arms like this. Push me away. Pull me towards you. That's fine. Okay. Is it okay if I just get you to take your trousers off?
No.
Back in.
Take your trainers off. She's going to need to. She might feel your feet as well.
Yes.
I'll get you to push your feet, so you need to take it all off. Okay. He's ready.
Okay. So if you can lie down for me on the bed, I'm going to just touch your legs to start with. Can you feel me touching you?
Yeah.
Is it about the same on both sides or different?
It's the same.
Now if I can get you to just sit with your legs hanging over the end. I'm just going to test the reflexes in your knees. If your child is experiencing back pain, the serious signs and symptoms to look out for are numbness, weakness and tingling of the arms or legs, and any bowel or bladder problems, so if they've lost sensation when they're going to the toilet.
Does there seem to be anything?
So from examining him, everything looks to be okay.
Yeah.
It's a bit unusual to have the pain and the numbness, though.
Yeah.
So I think for now, because the examination's normal, seeing how he goes over the next week or so with painkillers would be reasonable.
Yeah, okay.
And then I'll book him back in to see me and then re-examine again and see if things have got better.
Yeah, that's fine, no problem. Okay, thank you. Okay. Right.
Okay, so did you hear what I was saying to your mum? Things seem to be fine from examining you, but I'd like to speak to your mum next week just to see how you're getting on. Yeah, and if you know better, I'll get you back in and we'll take another look at you.
Good.
Okay.
Okay then.
All right,
Thanks very
take care
much.
then.
Thank you.
Bye-bye.
Bye-bye.
There we go, love. If anybody's got an appointment, you can use the self-check-in screen on your right-hand side.
If you've got an appointment, please use the self-check-in machine.
Has anybody else got appointments? Can you try and use the self-check-in?
If anyone has an appointment, please check in on the self-check-in.
Hi, Jim. Come in. Hi, I'm Dr. Sheikh. Have your seat, please. Right, how can I help you today?
I have been experiencing some nipple tenderness, and I'll be honest, about maybe a month, maybe 2 months, I had a little bit of discharge, and then it went away.
What colour was
it? It was sort of a creamy colour, and then it went slightly bloody.
Did it?
Yeah, but because it hadn't come back and it wasn't spontaneous,
okay.
I sort of didn't worry about it. But the last, I'd say, probably week, my nipple has been quite tender.
Which one?
The left.
And was it the same nipple that you had the discharge
Yeah.
to? Okay.
And I had discharge this morning.
So creamy in the beginning.
Yeah, and then
with a little bit of blood.
And then it went
was
slightly
it fresh
clear.
Blood.
It was more like a bloody discharge, but I only stopped breastfeeding in January, so I wasn't sure whether it was connected or not.
Okay. Did you have pain at that time?
No.
No pain.
No, the pain's only been really in the last week.
Did you do any self-examination to feel for any lumps?
I've had a feel, but not. There's nothing that I have felt.
Okay. Any family history of any breast problems or breast cancer?
On my dad's side, there was breast cancer.
And who had it?
His sister.
And how old was she?
I think she was in her late 40s.
Late 40s?
Yes.
Okay. We'll have to examine, yeah? So if you can take your T-shirt off and your bra off. So just tell me when you're ready.
Okay.
Yeah? Okay, ready?
Yeah.
Right, I'm going to examine your right breast first, okay? If you are in any pain, just let me know. So there's no been any discharge from the right?
No.
Show me your hand, just try and relax, yeah? Okay, and it's not tender as well?
It's a little bit tender,
but
yeah.
not much. Okay.
That's tender.
That's tender. If you can give me your hand, you can. Just relax, yeah. I couldn't feel any obvious lumps. Okay. I can't feel any lumps under your armpits as well. Okay, get dressed and just, you can come and sit here when you're ready. Okay. Now, with these symptoms, were you thinking about anything?
I thought maybe it was an abscess in the milk ducts because of the breast, or stopping the breastfeeding and stuff. And I also wondered if it's hormonal.
Sometimes when women breastfeed and they stop, sometimes they experience milky discharge. Yeah. But we do worry when it is blood with it.
Okay.
There are quite a few non-cancerous reasons, for the milky discharge, which you rightly said. But I would still suggest we refer you to the breast clinic. One, because of the family history. And second, because it is on one side.
Okay.
So what we normally would do is we refer under 2 weeks, which is a cancer referral. I can't feel any lumps, so that is reassuring. But please come back because we need to explore the other reasons.
Can I come back and see you? Yeah. Okay. All right. Lovely. Okay. Thanks
All
very
right.
much.
Take care. Bye-bye.
That's lovely. Thank you.
Come and have a seat. How are you today, Jenna?
Not too bad. Problems with my left foot.
Okay.
I've been to A&E.
Yeah.
They reckon I've torn my tendons.
Oh, I see, okay. Now, this all happened in April after you tripped over your dog, is that right? Okay. Pop your shoe off for me.
It's the only shoes I can get on.
Is that tender?
Yeah, very tender there.
Any pain underneath the foot?
No, I just get a burning feeling.
All around the top there where I was pressing?
Yeah, oh, yeah, that's where all that bit.
Okay. Because you're getting ongoing pain with this, I'm going to refer you up to the orthopaedic surgeons for them to have a look at this. They may want to do further imaging to have a look and see what's going on. Does that make sense? Because for you to have pain ongoing since April...
Oh, it's ridiculous. It is getting ridiculous now.
We need to get
I'm struggling.
In the interim, I'm going to give you some pain, some good pain relief. Which pain relief do you want at the moment?
I've been taking everything I can get my hands on. No,
Cocodamol?
Yeah, I've been taking paracetamol, ibuprofen.
I'll give you some more cocodamol because that's an excellent painkiller. The thing with cocodamol is it can constipate you. That's one of the main side effects.
I suffer big time like that anyway.
When you took the cocodamol, did you have a lot of trouble with the constipation?
Yeah, sometimes I can go 2-3 weeks without going to...
Gosh, okay. What I'm going to do then, when I give you the cocodamol, I'm going to cover you with a laxative as well.
And also I'm going to put my hands up. I haven't been taking my insulin because I haven't had none.
Okay, so you've got 2 liquid films in the eye, 1 water and 1 oil, right? What's happening here is you've got a little ball of fluid just underneath.
Yeah, it feels like
That's what
fluid,
you
yeah.
can So basically, that's a little bit red around this area on the right-hand side. After that, we clean up the area, and then I just slice it off at the base here. And that's it, really. If this doesn't work, then I want you to come back to us.
Spending more time here than we are at home.
Come and have a seat down there. So how is it?
It's all right. It's not so bad as it used to be.
Yeah.
I've just been cleaning it much more regular. Obviously today I've had a bath.
It's still
so
pretty bad, though,
yeah,
isn't
it's
it?
still bad. But...
Did we decide on taking out the whole nail or leaving a strip in the middle?
Yeah, taking a whole nail out.
Okay. And have you had local anaesthetics before?
Yeah.
Like you're going to the dentist, no problems with those? No. Okay. So the idea is, if we take this nail off and it grows out wide again, this whole situation might come back again.
Yeah.
Where it's all inflamed. So we put a chemical here called phenol, which effectively burns the bit where the nail grows on that side. So hopefully it will grow out not as wide, so it's less likely to cause you problems, yeah? And then take everything off, dress it. You've got to come back tomorrow for a dressing appointment.
Okay.
Is that going to be all right?
That's fine by me.
All right, so this is the consent form. There's your details there. All right, so it's a reasonably low-risk procedure, but there are risks, especially with the toe when it comes to infections.
I stubbed my toe like 2 days ago, and that hurt.
That must be horrendous.
So...
Yeah. It hasn't happened to me yet, but there is a chance that it doesn't grow back at all.
If it doesn't grow back, that'd be perfect.
Yeah, you prefer it.
it.
If you've got any questions, then fire away. Otherwise, if you're happy, sign and we'll get started. You can come and see me. I'll take distracting, screaming, swearing, whatever you like, as long as you keep the toe really still, okay? So first, scalp straps coming. You all right?
Mm-hmm.
This is a bit that you'll know if you can feel it. Okay, so just tell me, can you feel any of that? If you feel pushing, that's fine, right? If it's sharp, then tell me. Ground, is it?
And also, I'm going to put my hands up. I haven't been taking my insulin because I haven't had none. I'm diabetic as well.
Okay, Johnny, that's massively important. Insulin.
I know it's massively important.
Yes.
And I had it on repeat prescription at the pharmacy down by me.
Yes.
Then they went for a stage where they can't get a hold of the one that I was on.
So you haven't had your Lantus since last September?
Yeah.
So it's been a year.
Me and doctors, I don't like coming down the doctors unless I really have to.
Okay. I'm going to give you a blood test form. I want you to get an urgent blood test done, okay? I want you to try and get it done today. Yeah. I'm going to book you into our diabetic clinic with one of our diabetic doctors because they need to have a look and see what's going on with your diabetic control. Does that make sense? The risk of uncontrolled diabetes, a heart attack, stroke, you know...
I've already had one heart attack and I've already had a mini stroke, which has affected my sight.
So that puts your risks even higher. So let's get this sorted. What I'm going to do is I'm going to squeeze you in with the diabetic doctor next Thursday. What I want you to do is I want you to record your sugars 4 times a day, okay? So before breakfast, before lunch, before dinner, and before bed. And bring those readings in when you see Dr. Nanda next week. He can then have a look at it and decide what insulin regime we should get you back on.
I will go, definitely.
Superstar.
Lovely, thank you very much.
No trouble, lovely to meet you, Jenna.
Thank you.
Bye-bye now.
This is just normal cream, okay? It's just to protect your skin on the other side while I do the chemical bit. So it's going to stay numb for a few hours, but you should be able to walk and still wait a bit because you can still use the ball of your foot, so that should be all right. All right, Judy's going to dress it for you. So the really important thing from today is that it stays completely dry once we've done the dressing, because if you get it wet, then the chances of it getting infected are much higher. You'll be able to use nail polish again in no time.
Yeah.
Okay, darling, there you go.
Thank you.
Good stuff.
Thank
Take
you very
care,
much.
okay? No problem. I hope it settles.
I'll see you now.
Take care. See ya. Block worked really well on that one.
This is Holly.
Yes, hi, I'm a medical student. Nice to meet you.
Right, here. Do you want to take a history?
Have you got a headache? Yeah.
The average consultation time in the UK is 12.5 minutes. And that means before you even start your surgery, you know that you're going to overrun.
Hayden Ford? In the GP training programme, we learn time management techniques and aim to deal with problems in 10 minutes.
Felicity!
Increasingly, we're having to deal with more complex medical problems that require far more than 10 minutes to really get down to the bottom of.
It's like we play darts on a Wednesday night.
Sorry to bring you back, because we're a bit short of time today.
I'm prepared to bend the 10-minute consultation rule when I have a patient in front of me that clearly needs more of my time. If we deal with 4 or 5 problems in 10 minutes, then it doesn't work. We don't want to miss anything. We want to make sure that we treat it effectively.
Of course,
Does that make sense?
of course.
You've got a good going over today, believe me.
Bye. Take care. Gosh, the clock pressure's huge.
So that's about 30 minutes.
I know, that took me absolutely ages.
Yeah, but you went through everything, and you went through it very well and very methodically and logically. You do have to live with risk and uncertainty. But if you can say, do you know what, I feel comfortable, I'm not going to worry about that. If you're going out and going home worrying about a consultation, you maybe should have done this or that, it's often worth just giving the ring and getting it done or something. And you can't have that number of things playing in your mind.
No, get mad.
You go back.
That'd be great. Yeah, that's
Come on in.
Hi.
How are you getting on?
Yeah, good.
Perfect, good. Let's talk about the rheumatologist. I know we didn't really mention that last time we caught up. You last saw the rheumatologist in August, didn't you, actually, not too long ago. So how are things from that point of view?
Yeah, I would say it's mostly fine. I think my knees and feet do have the tendency to still swell occasionally. But I think apart from that, I think everything is still very firmly under wraps.
Good, good, okay. And just reading from the letter, I think the good thing is she didn't find any evidence of any what we call active inflammation in the joints, which is obviously the thing we worry about with arthritis because that can start to kind of damage the joints. So thankfully that's not the case. So long term, going forward, I don't think this should have any implications in terms of your mobility, in terms of the actual structure of your joints. I think really the priority will be to try and help you to manage your pain. Your rheumatologist felt that there were some elements of your condition that were more in keeping with a condition called fibromyalgia. I don't know if that was explained to you and sort of chronic pain.
Holly was diagnosed with a condition called juvenile idiopathic arthritis, which is a type of arthritis that affects young people. About a year ago, she was also diagnosed with a condition called fibromyalgia, which is similar and can cause pain all over the body, mainly in the muscle groups.
Were you referred to a psychologist?
Yeah, I started a pain management group Friday just gone.
You just recently? Brilliant, okay.
Psychotherapy is no longer really a controversial method of treatment for chronic pain. A number of different types of therapy, including cognitive behavioural therapy, or CBT, are often used as well as meditation and even hypnotherapy. And really the main thrust of all of these treatments is to try and help change patients' perception of their pain and change the way in which it affects their day-to-day life.
So it's not something, unfortunately, that will kind of go away magically with the things that we're giving you, but hopefully with the psychotherapy and the special sessions that you're going to be having, that will give you the kind of tools to manage it a bit better. And just a bit more about yourself. Are you working at the moment or no? Okay.
College.
You're at college. Fine. Okay. And how are things with that?
It's all going pretty well so far, yeah.
Yeah. Okay. Good. Good. Okay. So I think we carry on going as we are. Obviously, hopefully you get benefit from the sessions. If you need our help with anything, if you feel that things are kind of going back downhill again, you can always chat to us. Were there any sort of questions that you had or any concerns?
No, I think we're all good.
Good.
Awesome.
All right, take care.
Thank you very much.
All right, bye-bye.
Bye.
Hi there, Leanne. Come in. Right, what can we do for you today?
Just a couple of quick things.
Yes.
First one to get over really quickly. These little skin tags.
Yes.
How can I get them off? Because I'm getting loads.
Let me see.
That one's the main one, the big one, which is it gets caught up in my neck and rubs on it, and I've got a few under my arm and that.
Okay. Because they're very small, you twist them and then you can sort of cut them off. Sometimes you put a little bit of local anaesthetic in. It is a little minor operation.
Yeah.
But it would be very quick.
It's quick, yeah.
And what we do is sort of snip it off and then we cauterise the base just to stop it bleeding.
Yeah.
And that's pretty easy to do.
I want to do it, but I'm a bit wussy, so...
No, don't. Yeah, it's not a good idea because it will. You could do it, but it will just be right. Okay. So
that's the first thing.
Okay, I can do that for you.
The other thing I need at the moment, because I'm going through trauma therapy a lot, and it's brought a lot of problems back up.
Yeah.
And at the moment, I'm getting very, not just anxious, but I'm getting very angry as well.
Okay.
And I'm struggling to control it.
Yeah.
And I was just wondering if there's anything that I can be given or get or something to try and taper it down. I get also quite emotional, which isn't me. I don't cry for England, so just very...
And the therapy sort of sometimes is making that sort of come out, do you think?
It is, yeah. Something happened in my past, and obviously now it's been all brought back up. So.
Okay. And sometimes that's what therapy does. And there are things we can do to try and help reduce some of the anxiety. It may not get the anger down, but if you make you less anxious and sometimes a little bit sort of more stable, then you can sort of cope with the therapy.
Because that's what's happened. I think I'm getting so high up, I've started like cutting and stuff like that again, which I haven't done for months and months and months.
And you don't you're not going to do anything more serious than that, are you? There is something not right with this.
Yeah, I'm having a problem with my printer.
Do you want me to just shut it off and then turn it back on?
Where did that go to?
I'm just fighting with my printer.
No, it's definitely not working, that.
I think I'm getting so high up, I've started like cutting and stuff like that again, which I haven't done for months and months and months.
And you're not going to do anything more serious than that, are you?
I think you've always got those feelings there anyway. When you're depressed and everything's going on, that always there. So, but
You
no,
have them. Have you done anything about them?
No, other said than
The cutting? Yeah. And do you find the cutting's a bit of a release for you?
it does. But I mean, I used to work with the ambulance service, so I know it doesn't help, you know. But at the time, I think I get to that pinnacle where you're like, what do I do? And you know, as I said, that's when I do it. And yes, it helps. But then, of course, after you've got the guilt,
So it doesn't. It's a short-term relief, but and it's very difficult to sort of explain that sometimes to other people. But I can completely understand that. What I would say is that, you know, if there is anything else you can do just before that happens, like ring or talk to somebody, you may not be able to, then try and do that rather than cutting yourself. Obviously, you know, it's a difficult period. And what I'll do is I'll give you one of the antidepressants that is used to help with anxiety as well, to see if that then can help with it. Is that all right?
Thank you very much. Yeah, it'd be lovely.
There's definitely a stigma attached to self-harm, and people generally don't want to talk about it. But if we could break that, we can give people help. And we know that teaching people to deal with those crises of emotion can stop them doing things to harm themselves and sometimes stop them committing suicide.
Everybody thinks I'm quite like a bubbly person and talkative, and you just think you don't know the half of it behind closed doors, isn't it? But I'm getting there.
It's a facade, and you've probably had years of practice of putting on a facade so people don't know.
Big face.
And a happy face, but underneath you're just sort of crumbling and you need a little bit of help. If things get really bad, one of the, I don't know if you've ever done it, but Samaritans are very good. And just ring that. They make no judgments. They give somebody to talk to. And sometimes just having that ability, and it's not somebody you know, and it's not somebody related to.
It's not family and not
takes
friends.
a lot of that away. And they're very good at doing that. I mean, it has helped a lot of people. And sometimes you just need something to stop you making that action. And it keeps you sort of stopped long enough for it to pass away. That's what you need. You need it to pass over, because otherwise you have to do something to get you through. What you've learnt is, if I cut, then it goes away, it comes back, feel guilty, but and you need to unlearn that.
It gets rid of that first.
It gets that first impulse.
Yeah, you sort of feel on the edge of a hill and you think, oh, I've got to do something.
Yeah. But if we can and once you can stop that, you know, then, but it's a difficult time for you, I can appreciate it.
Sometimes that's all it needs, isn't it? It's just that little bit of extra help. I hate asking for help, I'm one of the worst, but...
You know, if you'd broken your leg and I said, here's a crutch, you'd have said, fine. If your mind's not working as it should do, it's a little bit of help to get you through a difficult period, come out and you then get on with your life again. And that's all it is. It's no different to that.
Very true. Hey, that is brilliant.
Okay, nice to meet you. Take care and see you again.
Okay.
Bye-bye.
Thank you. Cheers. Come and go.
Thank you.
How are you, Margaret?
Nice to meet you. Thank you for seeing me.
No trouble. How are you?
I'm not brilliant, but okay. I've come in because my nurse asked me to come in and see you. I've written it down because I won't remember otherwise. The not so good news under the circumstances is that in 10 days I've lost about 6 pounds, which is too much. I couldn't eat, and what I did eat, zoop. I really couldn't face it.
So you're having diarrhoea?
Yes.
How long has the diarrhea been going on for?
10, 12 days. And I mean, I've never not been able to walk, you know, and that I literally didn't. I could stagger, but I just didn't. I mean, it's ridiculous.
May I have a feel of your tummy?
Yeah. This is funny enough, the tummy is behaving itself. You know, I haven't had lack of pain for a long time.
Okay, so I'm just going to gently press.
Having said I haven't got any pain when you touch, I have.
Is it sore when I'm pushing now? Or?
There. Yeah, there. Yeah.
Just going to listen to the tummy. Good. Jump back down for me. Margaret was diagnosed with a form of kidney cancer in 2009, and in 2015 it was discovered that she had a recurrence. She was currently enlisted in a trial under the specialists, and she is undergoing treatment for this. Now, there's a few things that we are going to do, Margaret. Because you've had 14 days of diarrhea, it absolutely could be a side effect of your medication. However, I just want to make sure that there's no other cause or other reason why you'd be having the diarrhea.
Right.
So I'm going to ask you to send off 2 stool samples for me. When was the last time you had any blood tests?
Every 6 weeks.
Because you're getting the ongoing diarrhea, I'm going to request my own.
I think this is just a little glitch, and then we'll be off and running again. You
Absolutely. So here is what we are going to do. Okay, so that's your blood test form. So you book that in at your convenience. You can get that done here. These are the stool samples. Have you ever given a stool sample before, Margaret? Okay.
Thank you.
No worries.
I'm calm under fire.
It is important to make sure that we prioritise the most important ones. And, you know, the weight loss, ongoing diarrhea is definitely something that we need to get sorted. I want to chase your oncology appointment to get a review with them, and I'm going to give you something to help you with the weight, okay? And come back in and see us, Margaret. If this isn't settling down, I definitely need to come back
Don't
and
worry,
see
I'll
us,
be
okay?
here. Thank you. I think you've had the 10 minutes now, more actually.
Don't worry. The 10 minutes is only a guide. It's more important about making sure that we manage you as a patient effectively. Every individual is an individual. So add this to your blood test as well and get these things sorted. If it's not settling down, we definitely need to see you. Give us a call a week after you've done the stool samples to find out the
Okay, don't you worry, I won't mess around. I intend to make 10 years. At least.
Very good.
At least.
Good. I wish all my patients were like you.
Take care.
Lovely to meet
Thank you.
All right, okay. Bye now, Margaret.
Thank you so much.
No
Bye.
trouble. Bye-bye now. Is that all right?
It's fantastic.
See you later.
Okay, bye, Ashley.
later.
Bye. Be careful driving.
Thank you very much.
Okay.
Thank you so much.
Oh, he is so sweet.
Bye.
Good morning, Foreign Road Surgery, Amanda speaking. How can I help?
Do you self-harm?
I've quite a history of that.
Okay, like what?
Cut my wrists, so trying to kill myself several times.
I want a new pair of legs.
You are a candidate for a new pair of legs if you want a new pair of legs.
You might feel a bit pushed there. Oh, sorry, it might hurt a bit.
Oh my God, I feel my fingers tingling.
The trouble is, Dr. Shreya, I can put up with the hard skin, I can put up with the cracking, everything. It's the itching. It's unbearable. It's so bad.
Okay. How's your mood?
All up and down.
Recently, has it been more up or more down?
I get upset very quickly.
What I'd like to do is examine the back passage. Is that going to be okay?
Well, it's clean enough. I mean,
Yeah.
I'll give it a good wipe.
Yeah, okay.
Morning.
Morning.
Well, it is morning, but I don't know what's good about it.
Peter Fidgin. You want to come down? Yeah, how are you? Right, Dr. Bolger wants to see you after me.
So what do I do? Just go and wait in there?
Yeah, and I'll tell her that I finished with you, and then
Okay,
she will.
yeah. You finished for me?
Yeah, I've had enough of
It's
you.
all
Throw
over.
you out, yep. How are you anyway, my love?
Not bad. I've had a bit of time in hospital.
Oh, you haven't?
I got an infection and I couldn't pass water for a day.
Oh, God.
I was in there all night, A&E. Treatment was excellent, as usual.
I don't know, I was a little bit low at 1.8.
When you say low, that's too thick, is it?
Too thick, yeah.
Okay.
So I want you to go on 5 milligrams every day.
Every day?
Yeah, and I'll see you in 2 weeks.
2 weeks, is it?
2 weeks, yeah.
Okay, that's
That
fine.
one's that one, I have that one, you have that, so
one.
that.
Here we go.
And you take a seat and I'll tell Dr. Bolger that
I'm ready.
You're ready and raring to go.
Raring to go. Okay. Thanks a lot.
Bye.
Bye.
Yeah, that would be nice, yeah. Okay.
There's nothing to worry about. There's nothing to worry about, lovely.
Feel better.
All right, tell me, what's wrong with this little boy?
He's been ill since Sunday night. He's been having really high temperature, burning up to touch. He's hardly drinking anything. He hasn't eaten in 72 hours. And he's come up with...
Yeah, has he got it anywhere else?
Down his neck.
Has he got it on his tummy or anything?
No, it's okay.
Oh, should we listen to your TikTok? It's all right, I'm just going to listen to your TikTok, darling. This doesn't hurt. This is just... Listen, I can hear your TikTok now. It's going TikTok, TikTok, TikTok. Good boy.
Mummy, I don't want it.
You've been very brave.
No, I don't want it.
Now, we're just going to look for some strawberries in your ears. No, there isn't one on that side. Is there one on the other side? Oh, it's all right, baby. It's all right. Let's have a look. Let's have a look. You're ever so good. Nah, no strawberries. Well, that's no good, is it?
See?
I think there might be one in your throat.
Mummy,
You're going to go, ah.
No, I don't want it.
Listen, look, watch me do this.
Right, open your mouth, look, copy mummy. Ah.
Mummy, I don't want it.
Okay, I'm going to have to hold you then.
Mummy, I don't want
Good
it.
boy, good darling. I know. Oh, yeah, you've got rip-roaring tonsillitis, young man.
He's got what?
Oh.
He's got what?
Tonsillitis.
He's never had that.
I'm going to give him some penicillin. 1 spoon 4 times a day for 10 days to kill this particular bug, OK? For the next 48 hours, regular Calpol, ibuprofen, keep his temperature down while the antibiotic starts to work.
See, look, they give you some medicine, make you feel better.
All finished now.
You say thank you?
You were a very good boy.
Okay. Should we go take this to the pharmacy? Come on, then.
Bye-bye.
Thank you.
All right, take care.
Really raining.
Yeah, it's not very nice out there. It's going to be horrible at the weekend again.
You like that?
Come on, see down there. How you doing, sir? You all right?
Not too bad yourself?
Yeah, not too bad. So this cough...
Yeah, I'm no doctor, but
Yes.
I think it might be on a bit of a chest infection, somewhat.
So how long's it been going on for?
3 or 4 months now. But
3 or 4 months? OK.
in the last 2 weeks, it's just gradually gotten really bad.
OK.
I'm scared because I coughed up a lot of blood, really.
OK.
And then I started getting nosebleeds, and I don't normally get that.
And like bright red blood or kind of dark, or how does it look?
As in, it would be sometimes dripping out my nose.
So, but when you're coughing, I mean?
Oh, it would be in the phlegm.
Do you smoke?
I do, yeah.
How many a day?
Too many.
Too many. Yeah, that's the right answer, isn't it?
Yeah, that's it.
But how many? What you roll-ups? Are you buying them?
Roll-ups, yeah. I'd have about... I mean, at work, I'd have 3 roll-ups. And then when I get home in the evening, I do smoke a bit of weed, I'll be honest.
So, I mean, just independent of all this, I would want you to stop smoking anyway. I mean, there's lots of reasons to do so. In terms of the here and now, what's going on, so I'd like to check your temperature, have a look in your throat, have a listen to your chest, and then we'll see what's what. Yeah?
I don't know if it contributes to it, but there's been a lot of stress recently as well.
Okay.
Might have something to do with it.
Stress with work at home?
Both, to be honest. My job's only guaranteed for 9 months.
Oh, right, okay, fine.
And also at home, things are really bad at the minute. I moved over here 2 years ago, and ever since I haven't been able to find accommodation. I'm sleeping on a couch for 2 years. I don't have any friends, and as far as getting a missus or something like that, you know, it's a lot harder when you haven't got the things to do it.
Yeah. You haven't got your own space, basically, right?
That's it, yeah.
I feel absolutely wretched. I've got this, well, it's a bad cough.
Oh, dear.
I have this really bad cough, and when I start coughing, I can't even breathe.
I've caught a serious case of man flu.
Okay.
Is it a dry cough or does it sound chesty?
Man, do cough, honey?
A bit chesty.
Oh, God, sorry. Last night, her chest was really crackly.
Sure.
It sounded like Cocoa Pops.
Oh, goodness.
Oh, help me, help me, help me.
Do you feel like you're depressed? Do you feel...
Yeah, I won't lie. I've been depressed for 2 years, but I'm one of them people, I won't pay someone to listen to it, you know. My mum always says, go to get help and stuff. I don't agree with it.
In what way? Like, why?
I don't think it will help.
Well, you don't think what would help, though?
Like talking to a counsellor.
Okay, right. So, like, talking therapies and... Okay. Yeah. Do you sort of self-harming or anything like that?
I've quite a history of that.
Okay, like what?
Cutting my wrists, cutting just shapes and names into my body.
Okay.
So trying to kill myself several times.
Have you had thoughts like that since you've been here?
Yeah, quite a lot.
Have you done anything with those?
No, I was self-harmed when I first got here, but I taught myself out of that.
Cutting? Or?
Yeah, cutting.
Okay. It sounds like, even though, you know, you might think that the talking therapies and stuff isn't going to help you, I don't know, I think it might be useful. And the thing is, you've got nothing to lose by trying, do you know what I mean? Yeah. Unless it's a time issue. But the services that we have locally, they'll even do stuff like internet modules or telephone counselling for people who are struggling to make it to appointments because of work and all that sort of stuff.
I don't know.
Let me leave you with that thought, right? It's a self-referral system, no pressure. I'll give you the telephone number for it. Have a think about what I'm saying, and then if you change your mind, you change your mind. Have you ever been on medication?
For that?
Yeah.
No, I haven't. I've never spoken to a GP about it, to be honest.
Do you want to talk about medication, or...?
I'm quite happy just to, when I get home in the evening, just have my dinner and have a smoke and forget about it.
The thing about cannabis, it can cause you more problems, and it might be keeping you stuck with that kind of depressed mood more than you realise, even though that initial effect is to help you feel relaxed.
Yeah.
Does that make sense? So I'll give you the details for the talking therapies. Think about the medication if you want to know more about it. And why don't I book you back with me, say, 2-3 weeks down the line, and it just gives you a bit of headspace to think about what we've had a chat about, and then you can come back and just tell me how you feel about it. Does that sound all right?
It might not be bad, yeah.
Okay. So let me have a look at your chest and stuff first.
Yeah, of course.
Come on in. Have a seat. I'm doing all right. How are you doing?
Well, if you can understand this one, I'm just looking at it.
Is it confusing you?
These are the last few morning ones. That I've put AM instead of PM on some of them. I can't, but I've got to do it better than that.
If anything, these are running a bit low, aren't they?
They are, yeah.
You're going to threes too often. Now, every so often, you will get an odd one that's a little bit high.
Well, it makes me... I can eat more biscuits then, can't I?
No, you can't.
Hey?
No, you can't.
Can't you? I thought that knocked it up a bit.
What I mean is, though, that it's better to get rid of the low readings.
Of course, yeah.
Yeah? So I think that you're having a little bit too much insulin now in the evenings. So let's drop that back down to 24, yeah?
OK.
And the trouble with doing your sugar after you've eaten is that the meal mucks up the sugar reading. So the routine when you're doing a sugar reading in the evening is you do your reading, then you have your dinner, then you have your insulin.
OK. That's fine, yeah.
Okay.
That's good.
We're going to do this for another couple of weeks.
Okay.
Good.
Thanks a lot, Doctor. I'm sorry about all this.
Don't be silly.
I'm too busy picking horses out of the paper.
And are you winning?
Yeah, I am lately, yeah.
Good.
Not much. Something to do, you know.
Keeps you off the streets,
Keeps you up the streets. Thanks very much.
You take care, yeah?
Okay, yeah.
How long's your flight?
I'm not flying. I'm sailing.
From?
Southampton.
Oh, wow.
Yeah. Did you not realise that?
No.
Yeah, I'm sailing from Southampton. I've got 8 days straight sailing. Your mouth. I'll be well relaxed by the time I get there.
Yeah, you will.
Hi, can I help?
Deep breath in now. Okay, have a seat. Yeah. I'm not as worried about the blood that you're coughing up or the nosebleeds, right? So what I'd like to do is give you a course of antibiotics because I think there might be something going on in the chest, okay? If you have your course of antibiotics and everything goes back to normal, then I'm not so worried about this. But if you finish those antibiotics and you're still coughing up blood or you're still having problems, then we'll have to look at it again and then think about things like chest x-rays and stuff like that.
Thanks for that. That's great because that's a bit of relief off my chest. I hate bleeding.
Yeah. Okay, so that's 2 things for the appointment. One is just to have a think about the talking therapies. Let me know what you've made of this if you've decided to do something with it. At that time, you can let me know if you want to know more about medication and sort of how you're coping and stuff like that. And then we'll see how you're doing. All right.
But thank you so much.
No problem. You're welcome.
I'll look at your name.
Dr. Jiwanji. It's easier if you see it spelt.
Oh, yeah.
There you go. Although if you tell them the one at the hat at the front, they usually know who you're talking about.
Thank you so much for your help.
You're welcome.
It's also quite nice to chat to someone about that as well.
It's good you say that, because that's why I want you to think about that.
That's it, yeah, that's it.
Because it might actually be quite useful, you know?
Sometimes you get lost in it when you get home and you don't think about doing anything about it.
And also, especially the way you describe it, you could be quite isolated in that, and you don't have to feel that way, you know? There are people out there who know how to help you with that sort of stuff, so...
Thank you. Thanks again.
No problem. Take care.
And,
no problem.
Have a good day.
Yeah, you too. See you.
Cheers.
Bye.
Thank you.
Hello, come and see. We meet again. How are things with you?
A bit up and down.
Okay.
Up and down. But now the other hand is started.
Okay.
So
let's do the worst hand today.
Yeah, this is the worst one. I was reading on the side effects because I'm really sort of, you know, paranoid when it comes to taking new things. So I went and I read a lot on it last night. It's fine.
Okay.
Yes, I feel a bit more comfortable this morning. This is one of the more common forms of treatment, isn't it?
Some people have a marvelous improvement, up to 50-50 actually. Okay. So 50% of patients feel better for the next 6 months. And rest of the 50% come back in 2 weeks' time and say, no, it hasn't done anything.
Oh, that's not, I don't fall in that category.
Hopefully not. So there's a 1 in 2 chance.
Oh, my word.
So let's get a pillow with the sheet on. Of course, asepsis is quite important, which is what I'm trying to do here. Clean up that area of all the bugs. While that is drying, let me get some syringe as well. What does it feel like?
Really numb sometimes. There's a pain all the way up your arm, and sometimes it goes away if you're relaxed. While I'm at work, then it's always there.
Okay.
Like now I can feel the numbness when I do this.
I'll use a very small needle for you. Sharp scratch. Are you okay?
Yeah.
Good. Let's go for it then, shall we?
Yeah.
You might feel a bit pushed there.
Oh.
Sorry, it might hurt a bit.
Oh my God. I feel my fingers tingling.
The tingling is the area where the nerve is. So
I can feel it.
yeah. Okay.
All right.
And I'll call you back in 2 weeks' time. Okay?
All right.
All the best. Take care.
Thanks very much. Bye-bye. Thanks.
Anybody do anything spectacular over the weekend, or is it?
Did all my packing ready for my holiday.
It's all right.
So jealous now. Everyone's going away. I'm like, oh. Whereabouts are you going?
Going to the Caribbean.
Oh, nice. What part?
We're sailing from Southampton, doing 6 islands in the Caribbean, and then sailing back.
It's all right for some, isn't it?
Mrs. Ibrahim, please. Please come on in and have a seat. I'm Dr. Bolger. How can I help today?
I've been about 2 to 3 weeks now. I'm struggling with some dizziness.
Does this ever happen before?
No.
No? Okay. You've never gone, as it were. You've never fainted or passed out.
I have in the past, but it's been a good 5-6 years since
it happened.
It's happened.
So, every day you feel it?
Most days,
Most
yeah.
days. When it started, it didn't start with a cough or cold, no earache, wheezes,
No, I'm
sneezes?
waking up with quite numb hands. I had that after having my first baby as well, and I think it's the constant sitting. I'm breastfeeding, by the way.
Right, okay. Do you think it's positional?
I'm not sure because it's getting worse.
Okay.
To the point that this finger's causing me a bit of discomfort. So I'm not sure.
I'm obviously more scary than our healthcare assistant. I mean, that's perfectly normal. It's absolutely fine. Okay. I think it would be worth just running a few blood tests, yeah? The things that we would check, the obvious one is iron in someone who's been pregnant and also who's breastfeeding, yeah?
Okay.
Then we will just do your blood count and your ferritin levels.
Okay.
Your pulse and blood pressure are absolutely fine. So it may well do what it's done before, which is just melt away, and of course that's great. Yeah, but what we'll do first off is we'll run those tests. Regardless of the blood tests, if it's still persisting, and certainly if you're getting new symptoms, we'd like to see you again.
Yep. Thank
Anything
you very
else?
much. No, that's all.
Perfect.
Nice
you take
to
care.
meet you.
And you. Bye-bye.
So when you say you had blood, when did that happen?
Yesterday, yeah.
Yesterday. And that was blood when you opened your bowel?
Yes, it is.
Yeah,
It is actually,
okay.
yeah.
And how have your bowel habits been over the last few months?
Very good, actually.
Yeah?
Well, I mean, my stomach sort of it plays a tune for me, you know.
Okay, all right. Yeah, okay. When you noticed blood, was it mixed in with your stool, or was it just when you...
It was mixed in with a very soft
Stool?
Yeah.
Okay, okay.
Stool.
And was it painful when you passed that motion? Or?
Painful. It was because it was very, almost liquid.
Liquid. Okay.
Form.
Okay.
It was too easy.
Right.
I almost didn't make the toilet,
Okay.
but now I've just had a this morning, and no problem.
No problem. Okay.
So what am I wasting your time?
No, not at all. And you've had some problems with your prostate in the past, I understand. Is that right?
Prostate, yeah.
Yeah?
Yeah.
Okay. What I'd like to do is examine you, okay, to feel your tummy, but also to do examination of the back passage as well today. Is that going to be okay?
Well, it's clean enough. I mean, I
Yeah.
gave it a good wipe this
Yeah,
morning.
okay.
Okay, doctor.
Yep. All right. Is it okay if my colleague comes in as well?
Yeah. Well,
Yep.
yeah.
If you need to lie on your back, actually, sir.
Oh, on the back.
Yeah, on your back. Yeah, yeah. So maybe I didn't explain that properly. There we go. If you find this too painful, you let me know, okay? Okay, I'm all done. So you get changed in your own time.
Right. Thanks very much. How is the prostate, by the way?
So the prostate feels smooth, but what I think we do need to do is find the reason why you had the bleeding. So I think really what we ought to do is refer you for a camera test in the back passage,
Okay.
where they make sure that there isn't anything more worrying going on inside the bowel to cause bleeding.
Mm-hmm.
That's usually done in a clinic where they see people who we suspect might have something like a cancer in the bowel, and they usually see you within 2 weeks. Yeah.
Right, thank you
Is that all
very
right?
much indeed. That's wonderful.
Okay?
Thank you.
All right, no worries. You're doing very well for
Is
75.
one going to be here tomorrow? One never knows.
All right, nice meeting you, sir.
And you too. Thanks very much,
See you
doctor.
later. See you later.
You had your hair done? No. Looks like it's a different colour.
It needs doing.
I'm having mine done. Ready for my holiday.
You can go off people, can't you?
Yes.
Ready for my holiday.
Oh, yeah, I'm not envious of our holiday.
No.
Would you not go to the Caribbean?
Not on the boat, I wouldn't know.
Why not?
The thought of sleeping in the middle of the ocean, I just don't. No. I don't like that.
Hi, Denise. Come through, come over, see. No trouble, thank you for waiting. How can I help today, Denise?
I've been coming here with my foot. I was told that I have plantar fasciitis. I feel at the point now I really can't go on any longer. The pain is there every day. It's like I'm walking on an open wound. That's how bad it is. It's, you know, I need some further investigation.
That's sore if I'm pressing.
Shall we crack on?
The back pain, obviously not good.
My son called an ambulance. Pain was that bad. It's painful.
Very. When I do this, I can feel the bits moving inside. It's really painful, so much so that, you know, I can't lift the teddy bear up.
Wow. So that's quite significant pain then. Okay.
I'm not going to do anymore.
Point to the place where you're getting the most pain.
Right, the pain is around this area.
Yes, okay.
Sometimes it comes up to the back here. Sometimes it's all along here.
And what have you been doing for the plantar fasciitis?
I've seen the podiatrist.
Yeah.
I've had some insoles.
Yeah.
And exercises.
Which exercises?
Stretching the calf muscle.
Such as how?
And I stand and face the wall.
Yeah.
And stretch the back of the calf muscle.
How many times a day are you doing that stretching?
I say about 10 times.
Denise, I had this myself. Okay, I had this myself, and it is very painful. It is worse in the mornings.
It's worse when I get out of bed.
Exactly.
I can't really walk.
Yes.
And like, I'm on my feet all day long when I'm working.
The plantar fascia is a thick fibrous tissue that sits at the bottom of the foot. And plantar fasciitis is when damage occurs to this fascia where it connects into the heel, causing, in some people, incredible amount of pain. There are many different measures that we can use to help get the patient better. We initially try conservative measures such as weight loss and painkillers. Stretching and exercises are very important, and there are other options which include orthotics, shockwave therapy, and injections. The absolute best treatment for this is the exercises, okay? The one that you're doing against the wall is excellent, okay? So you put your hands against the wall, you put your left leg back, and you stretch out the leg, okay? The other thing that you can do is stand on the bottom step, you lower yourself down, and then you bring yourself back up. Really important to stay on the bottom step because I don't want you falling from the top step down. Does that make sense, okay? Okay, what I'm going to do is I'm going to give you an information leaflet on this. What it does is it goes through the exercises that you need to be doing. There we go. So have a read of that. Let's get you better.
Thank you so much.
No trouble, no worries, Denise. Bye-bye now.
Saint, hi, come through. Hi, I'm fine. How are you? Saint's here for his preschool boosters. Does he know what he's here for?
Yeah, he's not really happy about it though.
No. So he's here for 2 in today. So it will be his second MMR and his booster of his tetanus, polio, whooping cough, and diphtheria. So he's got 4 in it. Okay, so it's 2 injections, 1 in top of each arm.
We're ready for it, aren't we?
Are you going to be a brave boy? Are you going to be the bravest boy I have in here today? Oh, brilliant. So if we put his hands, I pull these up. Sorry, sweetheart. I know you don't want to have it,
You said you were going to be brave.
I want you to be a brave boy. Some of them are worse than this, don't worry. It's all right, Say.
Because you don't know what to expect.
You think it's going to be worse? Good boy. Oh, well done. That's the first one. That's the first one, Dad.
One more.
One more. Good boy. Nearly done. Just stay still. Good boy. Good boy. All done. Just a little bit of it. There you go. All done. Good boy. Mum needs some. I think Mummy needs a sticker as well. So which one do you want? You choose which one you want. You want the big one?
And this one.
Where are we going to put it? On here or on your top? Other top? Should we put it there? Do you want? There you go. Mummy's got a sticker. You were very brave. There we go. There's your book.
No more.
All done.
Thank you.
That's all right.
Have a good day.
Thank you. Take care. Bye, Zane.
Not your friend.
Bye.
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 Okay, how can I help?
Right, can I book an appointment for my son? He's 6 weeks old, so is it 8 weeks for the...
8-week checkup. Is little one behaving?
Yeah. It's just the dad that's not.
Oh, bless. Is it your first?
No, I've got 11 kids.
How many?
11.
11?
Not off the same mum, thank God.
I thought having 2 was bad enough.
Carol Dixon, Carol? Hi, Carol.
Hello.
Morning. Thank you for waiting. Come through, can I grab a seat, Carol? How can I help today, Carol?
I just don't feel right at all. I've had this terrible headache for 2 days here.
Okay.
Then it goes to the back.
Yes.
Then it goes to the side.
Yes.
Well, I am on blood pressure tablets, but I don't know if it's anything to do with my blood pressure.
Yeah.
And also, I keep getting these dreadful sweats.
How long has this been going on for now?
Oh, I've had this a few months now.
The sweats?
Mm.
Okay. With the headaches, you said it's been 2 days.
2 days now.
Do you suffer with headaches usually?
Not really, no.
Okay. Has it settled down now?
It's settled down, but I feel lightheaded.
Any dizziness?
No.
Any vomiting? Loss of consciousness?
No.
Any visual disturbance? Weakness, numbness, pins and needles?
Well, pins and needles I've had terrible in my hands for months.
That's been going on for months as well.
Oh, yeah, absolutely.
Eating, drinking well?
I'm not eating like I used to eat.
And mood, Carol, how's your mood been?
No, up and down.
Recently, has it been more up or more down?
I get upset very quickly.
Okay. Anything in particular that makes you feel upset?
No.
Hello, young man. Wet and miserable out there, isn't it?
Yes, very.
Right. Now, what can we do for Cody?
Well, basically, I'm here to see if there's any chance that you'd be able to refer him for me.
Because?
Because he's, for the past God knows how many months,
Yeah.
he's constantly got diarrhoea. I could change his nappies as much as you'd change a newborn.
Uh-huh.
My nephew's got celiac disease.
Right.
So's my uncle.
Right.
My brother had milk intolerance when he was born.
Yep.
So I was just seeing if maybe there's a way of testing him, if any chance it could have been
Related
with
to
him.
an intolerance,
Yes.
yeah. It's certainly possible. There's a long history of people there with it, isn't
Yeah.
there? Is he putting on weight and stuff?
He's only 25 pounds.
So he's not...
He's
not
very
as
little,
ambitious,
yeah.
Okay. And does he seem to sort of get irritated by actually having wheat products like bread
He
and
refuses
stuff?
to eat.
Or... So he's refusing to eat it really, is he,
Yeah,
as well?
it's literally, he'll just throw his food. If he does, he'll literally just not
Is he still
interested.
having milk or not?
Milk, he's not having it as much, but sometimes I can give him like tea or maybe
Yeah.
a hot chocolate or
Uh-huh.
something like that.
Yeah. Celiac disease is an inflammatory condition of the bowel where the body attacks itself, caused by the gluten sensitivity that they have. It's not an allergy and it's not a food intolerance. Children with celiac disease get very similar symptoms to adults, such as the stomach pain, diarrhea, and sometimes blood in the stool. If celiac disease isn't treated properly in a child, they may be failure to thrive, where they don't grow properly, and if it becomes very severe, they may not reach puberty when they should do. If it's treated properly by removing gluten from the diet, then none of those things will happen, and they can lead a normal and happy and content life. I mean, it's possible that he's intolerant to any of those sort
Yeah.
of things, and normally what you do is try and exclude it with this group and then see.
Yeah.
I think because you've got sort of
quite a long family history of various things,
Yeah.
and he's underweight, it might be worth then just sort of seeing one of the paediatricians with a view to perhaps looking at doing some...
Yeah, that's fine.
Does that make sense?
Yeah.
Yeah? Otherwise, you're happy with his development and everything?
Everything else is fine.
Fine, yeah? Yeah, you look bright and alert. Good. Well, I'll drop them a line with a view to sort of looking at testing for all of those conditions. Okay.
Yeah, that's fine.
All right.
Yeah. Okay, that's brilliant.
Okay.
Thank you.
Righty-ho. Here, so I'll grab that door. And
Thank you.
You
Come
can
on
get
in.
out.
Come on in.
Bye.
Thank you.
Okay, take care.
And you. Babs, come here.
I think my finger's gonna fall off.
Sorry?
I think my finger's gonna fall off.
Your finger?
Yeah, I shut it in a chair.
You mean your fingernail?
Both.
Do you want me to get a doctor to cut it off for you?
No.
Dr. Jiwanji's really good at amputation.
I just can't feel the end of it. I squished it.
You've squashed it, have
Yeah.
you? Oh.
How long have you been feeling like this for?
Oh, quite a while.
A few months, few years?
Well, I'd say about the last 9 months.
Anything in particular that changed over the past 9 months?
Yeah, I've got a friend whose husband died of Parkinson's. And I've been going, I feel so stupid.
It's okay, you've definitely got nothing to feel silly about.
I've been going up there nearly every day. And it's just sort of got me down a bit.
Have you had any help and support? Carol, I'm glad you mentioned it, so we don't want you feeling down like this, okay? There's lots of things that we can do to help. So there is a support team that we have. It's called Talking Therapy. What they do is they give you the right tools to help lift your mood from down there back up to where it should be. Right? I think those are definitely the people that you should be contacting now.
Can't do any harm.
Absolutely, absolutely. Well, they're there to help. They are there to help. All right, so let's check your blood pressure. Have you taken your blood pressure medication today? Yeah. Okay, Carol, your blood pressure is up today, okay? So what I'm going to do is I'm going to add in another medication to bring your blood pressure down, okay? And I'm going to book you a review tomorrow morning for one of the doctors to recheck your blood pressure to make sure it's calmed down to a region that we prefer it to be in. Does that make sense, okay? Now, there's lots of things that can cause headaches. One of the things absolutely is blood pressure. Sometimes that can cause headaches. The other things, you know, when people are feeling down and very stressed, that can cause headaches as well. Does that make sense? So we need to get both of these things sorted in your case. There we are.
Lovely.
So, Carol, take your medication.
Yeah.
And I'll see you tomorrow morning.
Oh, sorry about that. I feel so stupid.
Definitely nothing to apologise for.
Yes, lovely. Thank you very much.
No trouble, Carol.
We'll have to watch how I get up. I'll go
Yes.
slightly giddy.
Okay. So let's see you tomorrow morning.
Thank you.
All right.
Bye-bye.
Bye-bye now.
Mrs. Notley, hi. Come in, take a seat. I'm sorry for the wait. So, you're out of puff.
I'm out of puff and my knee's playing me up. I meant to have mentioned that. Look at this.
You've got arthritis, haven't you, in that knee?
Something in it.
You have, yeah.
I want a new pair of legs.
You are a candidate for a new pair of legs if you want a new pair of legs. That's very clearly arthritis going on in that knee, and possibly reached the point that you would need a knee replacement. Would you consider that?
I've had one done.
That one?
That one, yeah.
Would you consider having the other one done?
Yeah, how long's it going to take?
Yeah.
You know, that's the waiting list, isn't it?
Yeah. We could get Dr. Wood to put a steroid in it.
What's that?
A steroid injection into the knee. It tends to settle the pain down.
Yeah.
Should we do that? All right, OK. So for that, that's a quick fix. I can get Dr. Ward to do that. You're really out of puff.
I know.
I'm trying everything to try and get that off, but no matter how much I get off,
It keeps coming back constantly.
They're very dry, aren't they? Why are your hands this colour?
I just put the yellow powder a little bit. to
What,
clean it.
turmeric?
Yeah.
You've put turmeric on your hands?
Yeah.
And I have noticed recently that she scratches herself a lot,
Really?
to the point where she makes herself bleed.
Oh, bless her.
If I pull my head over,
Yeah.
shake it,
Yeah.
it's a snowfall.
So almost dandruff type.
Yeah, but
Lots of
more
flaky,
itchy,
dry
yeah.
skin.
There's no bus anymore. I had to get a taxi here, cut our bus out totally. There is no transport whatsoever.
When did that happen?
About 3 weeks ago, when they first did the new bus routes.
Yeah.
No bus whatsoever. How can you do that? Not be able to get to... Anyhow, never mind, you're busy. Look, while I came, I've had 3 lots of antibiotics. Now, because most of them were done over the phone, obviously they couldn't see it. But the last time I saw a doctor, he wasn't a skin doctor like you. Now, it's just like going to the dentist, it's cleared up now. But I just want to show you where it was. I keep getting this cellulitis, which probably happens with the scratching and the cracks in my feet. And I've had 3 lots of antibiotics, which I didn't like taking. First of all, see, I get it here. That's where I always get it. Then it spread. I had it across here, all round there. But the worst thing was here. This went all like orange peel, went mauve, and it was puckered. Do you know what I mean? All puckered in here.
Yeah.
And it was like when I walked, like elastic band round my leg, shooting pains up my legs, and the pain was excruciating.
How are you? How are you? Nobody yet?
Yeah.
Long time?
Yeah. Still a swing.
Let's have a listen, see what's going on. Can you zip that up?
Yeah.
You've got really fine crackles all over your chest. Let me check your blood pressure. It's really playing up today, I don't know why. Let me do it the old-fashioned way. Gets serviced once a year and it keeps on going.
That's what I mean, see? All this modern technology. I don't believe in it. Give me the old-fashioned ways any time.
Blood pressure's up a bit. We're going to repeat the chest x-ray because we know that's a bit odd anyway. You always got scarring in your lungs. I'm tempted to increase your water tablets because I think there's some fluid on your lungs, and see if we can take that off and get you less breathless. And I'll see you again in a couple of weeks and see how you're getting on. Okay? Is that all right?
Yeah.
Pop down for your chest x-ray and we'll take it from there. Okay?
Okay.
All right, we'll see how you get on. Obviously, in the meantime, if you get worse, please come back and see us. Don't soldier on at home.
Yeah.
I know you like to soldier on. Don't soldier on.
I'm not one for doctors and...
I know that.
One bigger than the other.
I know that, but then, do you know, things do go properly wrong with you, and then we need to know. All right, take care of yourself.
Okay.
All right, bye. Have a good weekend.
And what was it, diarrhea for how long, sorry? 3 days. Right, okay, I'll put that down for you. Okay? Thank you, bye. Oh, how do you spell diarrhea? Dio.
You're asking the wrong person.
It's such a hard word. I'm gonna Google it. Oh, I've definitely spelled that wrong.
Do you ever think that?
It's a good thing you've come today, actually, because there has been sort of another product that's come into use, which is for psoriasis.
The trouble is, Dr. Shri, I can put up with the hard skin, I can put up with the cracking, everything. It's the itching. It's unbearable. I can't sleep at night. I wake up 3 or 4 in the morning with the itching. It's so bad. What is it, though? A cream or a...
It's kind of like a mousse.
Literally, I could scratch until I ripped my skin.
It's always been one of the things that I think has most irritated you about this, isn't it? So I will.
My God, they're running late out there. I think it's only you, isn't it? See, you shouldn't be so popular.
No, it's not that. I think we're
You're
closing
too
up
nice.
there.
I'm telling you, you're too nice. Because where most doctors, they sort of just chuck you out, you know, and you
Really?
chat. Oh,
That's
yeah.
not what I've seen.
Yeah, some of them do, I can assure you.
There are times when we do have to run though because the problems just cannot be done within 10 minutes. But there are also occasions where you know the struggles. Like for example, who've had to come in all sorts of ways to get here because your bus routes changed means that how can I say
non-existent. It's disgusting. How you can leave a whole community of people stranded, unable to get to the chemist or the doctors or public transport.
So that's the new foam. You have to physically rub it in.
Oh, I'll try anything.
Might be
Let's
better.
face it, I've tried everything else. I didn't like taking all those antibiotics.
This obviously is not a tablet, so hopefully you won't have any problems. Okay, good.
Yep.
Nice to see you. Take care.
Lovely seeing you as always.
All right.
Bye-bye.
Have a good day. Bye-bye.
Thank you so much.
That's all right. Have a lovely day. Lovely to see you.
Okay, thank you. Bye-bye.
Bye-bye. All right. Bye-bye. Bye. Bye.
All right, my darling. See you later.
I'll see you next week. You have a beautiful day.
And you.
Bye. Give me a high five. Brilliant.